It feels more like a family or like a group of friends than actually co-workers.
It says a lot if you want to hang out with the people you work with outside of work.
I don't know how it works, it's just like this weird, crazy, dysfunctionally happy family where you have people from all walks of life, all different ages, all different colors. You can see yourself in everybody, and everyone can see themselves in you.
We at the UT provide one of the best residency training programs in OB-GYN in the United States.
We believe in the hit the ground running approach. Our interns are able to deliver babies and they get into the operating room doing cesarean sections so that they feel comfortable as they are promoted in their training.
The clinical experience here across the board I think is phenomenal. You have great access to amazing faculty who are passionate about what they do, and then your patient population is really diverse.
It was really important to me to go somewhere where I felt like, leaving that residency program, I had really experienced a lot of the pathology that you would see in OB-GYN, and not something that I had just read about, but actually experienced and taken care of those patients.
We're a referral center, so patients come from all over the region to seek care in Memphis and at our institution. So they're well trained in high-risk obstetrics, and any cases that come through the region, our residents have access to.
The hospital system too is really strong here. We get to work at private hospitals, we get to work at government-funded hospitals.
Especially second year, you get to work a lot more with the private doctors, and so it's really nice to kind of see what life as private practitioner is like, or maternal fetal medicine practitioner is like.
In my private practice, I actually practice at Methodist Germantown Hospital and Baptist Women's Hospital. I am a clinical faculty now, so I have residents that rotate through with me in the office and in the operating room as well. What really I learned throughout residency had truly prepared me for that jump.
Adults learn differently in small groups independently, so we've changed our didactics to accommodate that.
Small groups is my favorite part of didactics. I think that's true of everybody. And it's when after your general didactic session you break into a group and you meet with an attending for 1 to 2 hours and you go over a topic. And it's a really interactive, sort of freestyle, very open forum for learning.
We have different lecturers, either from our staff or from outside hospitals, that come talk to us about different things related to OB-GYN. We also have our M&M sessions, teams on labor and delivery and GYN discuss their cases from the past rotation, and you'll get that oral board prep there as well.
Most of the faculty have subspecialized training, and so the residents get the best of both worlds when it comes to the education and the subspecialty knowledge that they need.
We have several attendings who are very well skilled in robotics. One of the great things is that you don't just have to sit there and watch, they actually let you do it.
From day one, as an intern, I was able to scrub in and start work with hysterectomies and C-sections and every other surgery out there.
The number of cases and surgical expertise that our residents really participate in, is comparable to some of the best institutions in the country.
Our department currently has 2 fellowships, one in maternal fetal medicine, the only one in the state of Tennessee, and one in minimally invasive gynecologic surgery.
I will be staying here for my fellowship, which was my #1 choice. It's the perfect blend between clinical and research.
Of the residents who've completed their research projects, we've had 6 so far that have been accepted to present at both national and international conferences, and that's something that is a tradition here.
I was able to go to the Society of Gynecological Oncology annual meeting and present a poster, and this year I've been able to go to the Society of Gynecological Oncology meeting again, and I have a plenary presentation this year.
Members of our department have published papers in the field of obstetrics and gynecology, and the standard of care in many areas of obstetrics and gynecology has changed because of these studies.
I didn't really know what to expect with Memphis when I moved here, and I've loved it. I've been so surprised.
I highly recommend for people to really get to know this city. There's so much to offer, the culture, the music, the food, of course.
And our life is not all completely work. We do work really hard here because that's just what the patient population demands, is to work really hard. But after work is over, we go out into the city, Cooper Young area, Overton Square. Memphis has become our little oyster. You can rely on everyone. Regardless of what class they're in, someone will always be willing to help you. If I had to do it all over again, I would do it just the exact same way that I did it.
It is a great time to come to the University of Tennessee for residency training in OB-GYN because the residents will find a family and we prepare the residents for their future